Hello and welcome to another episode of Subluxations in Your Health. I'm Dr. William Soriano, an upper cervical chiropractor and the owner here at the Georgia-Pacific Clinic of Chiropractic in Winder. Today, I'm going to be talking about fibromyalgia. Now, my hope is that I can give you information that is not only interesting, but more important, that you can then take this information and give it to someone who may be suffering with fibromyalgia. This is information that could possibly give that person the hope that they're looking for to let them know that something can be done for them. So please share this information, especially if they've already done everything else and haven't really gotten anywhere. Fibromyalgia affects roughly 12 million people in the United States, mostly women and in particular middle-aged women. However, more and more children are being diagnosed with juvenile fibromyalgia syndrome. That's right. About 25 to 40% of children who have chronic pain meet the criteria to get a diagnosis of juvenile fibromyalgia syndrome. And this is very important because when adults who have fibromyalgia are questioned, about 28% of them are going to say that they first started having symptoms when they were children. Another thing that can be a problem for people with fibromyalgia is that this is not a very easy condition to diagnose because there aren't any standard medical tests for it. And when you couple that with a general lack of knowledge by most physicians regarding the condition and the fact that there isn't really any objective physical evidence, it's real easy to see why someone who has fibromyalgia can become frustrated and even depressed. What ends up happening is these people go from doctor to doctor to doctor, spend thousands of dollars on medical expenses that don't really get them anywhere, and as many as 50% of them end up having unnecessary surgery. We know that the average cost that a person with fibromyalgia is going to incur in 1 year's time is roughly $11,000 and not really get anything for it. So what exactly is fibromyalgia? Fibromyalgia is a chronic pain condition where a person is going to have pain all over their body for no apparent reason. And they can also have other symptoms that go along with that. They can have stiffness, they can have fatigue, they can have trouble sleeping, they can have migraines or headaches, they can have digestive problems or what is diagnosed as IBS, irritable bowel syndrome. They can have jaw pain, or what's called TMJ. They can have carpal tunnel. They can even have an inability to withstand cold temperature. So do you see why this can be really frustrating? You have all these symptoms from all over the place. They don't really seem connected. It can definitely drive a person crazy. Now, aside from feeling terrible, these people a lot of times also are very stressed and feel a lot of anxiety because they're not getting anywhere. The problem is that stress and that anxiety increases their symptoms, which gives them more stress and anxiety, which increases their symptoms. It's very easy to see how this can drive someone crazy. Now, in order to actually get a diagnosis of fibromyalgia, you must meet the following two criteria. Number one, they're going to have pain in 4 quadrants of their body for a minimum of 3 months. And number two, they must have at least 11 of 18 trigger points for a period of at least 3 months. When they have all that, then they meet the criteria and will get their diagnosis. Well, then what do? Well, the standard medical treatment isn't very effective. Up until right now, there isn't any known cure for fibromyalgia. So anything medically that is done solely for the purpose of alleviating or relieving symptoms. And most experts say that it's not very effective. A lot of times people with fibromyalgia will be given medications that would normally be given to a person that has rheumatoid conditions. These can be things like aspirin or non-steroidal anti-inflammatories, but they really do little for the pain. They can also be given corticosteroids, which are more powerful drugs, but they also fail to help with the pain and the stiffness and the general fatigue that a person with fibromyalgia has. It really gets to a point where a person with fibromyalgia will literally try anything to try to get some help. And in many instances, they're given just about anything. All this running around trying to feel better will cause a lot of medical doctors to do something that's called off-label prescribing. So this is when a medical doctor will give someone a medication that was designed to be used for an entirely different condition than what they have, in the hopes that that medication will help them with their problem. And when it comes to people with fibromyalgia, they can be given a whole range of medications for things like depression, or medications that would be given to people who have seizures or people who have narcolepsy. And these are the kind of medications that they get. And you know what? They're not really effective. These people still get nowhere. So now, not only are they more frustrated and still have their problems, but now they're also left having to deal with all of the direct effects from these medications and the long-term damage that is inherent with all of these medications. So when it comes to the depression medications that they'll give someone with fibromyalgia for their fibromyalgia, they can be giving things like Cymbalta, or Effexor, or Savella, or Paxil, or Zoloft, or they can be given medications that people with seizures would normally get, like Lyrica, or Neurontin, or Ativan, or they can be giving medications that people with narcolepsy would get, things like Elavil or Emitro. And the direct effects from these medications can range anywhere from drowsy, to dizzy, to constipation, to weight gain, to muscle pain, and even suicidal thoughts. And the problem with that is it doesn't really fix their problem. And a lot of the side effects are the same symptoms, like the constipation and the muscle pain. These are things that a person with fibromyalgia already has. Even drugs that are seemingly benign, like Advil or Motrin or Nuprin, even these drugs are dangerous. We know that those drugs are a leading cause of kidney failure. As many as 20% out of 120,000 people who have end-stage kidney failure, it is being caused directly by these types of medications. So it doesn't really help, and it creates a bunch of other problems. So why is this happening? Why does fibromyalgia happen? Well, the truth is that it's likely a combination of many things, but most researchers agree that the primary reason for fibromyalgia is a malfunction in the central nervous system, particularly in the way that the central nervous system perceives pain. And so this can lead to an abnormal perception of pain. Now, the actual cause may actually be a combination of a problem with the neurology in different parts of the brain that control things like blood flow, or sleep, or muscle use, and the transmission of pain. And when this problem stays like this, it ends up triggering false alarms of pain out of nowhere, or out of things that normally wouldn't make a person feel pain. This tends to go on, and over time, it leads to something that's called supersensitivity. So supersensitivity is what happens when the nervous system becomes oversensitive to any stimulus. Another thing that we know has been implicated with fibromyalgia are head and neck injuries, things like whiplash. In the case of whiplash, when a person has this accident and their head slams forward and then slams backward, in that process, all of the muscles of the neck are going to tighten up to try to make the neck rigid in order to protect the spinal cord and the brain. But in doing so, the ligaments and the muscles themselves become overstretched and tear, and that can lead to problems like migraines and fibromyalgia or other chronic health problems. Even if there's no fracture or no immediate pain during the accident. As a matter of fact, we know that a rear-end collision of as little as 5 miles per hour is enough to cause permanent ligament damage. And a lot of times, the symptoms that come don't show up for weeks, months, or even years later. So even a small, or what a person might consider a small accident, can be a big problem, especially if someone already has fibromyalgia. And really, this is where chiropractic can be so helpful for someone who has fibromyalgia. When a person has a whiplash injury, or an overuse injury, or an injury that comes from repetitive use, these types of problems many times can create what's called a subluxation. Now, subluxations are what chiropractors call it when a bone in the spine has misaligned. And that misalignment can cause an abnormal function in the brain's neurology, in the way that the brain communicates with the rest of the body. This can be things like the transmission of pain, or blood flow, or muscle use, or a proper ability to adapt to an internal and external stimulus. And a lot of that sounds like what fibromyalgia is. Now, chiropractic has never claimed to cure fibromyalgia. However, chiropractors are the only professionals that are trained to locate, analyze, and correct subluxations. Another thing that's also inherent with subluxations is compensations in the rest of the spine and the body. Some of these compensations lead to poor posture. And we know that poor posture is another thing that has been associated and linked to fibromyalgia. So really, any attempt at correcting fibromyalgia without correcting the bad posture that in many cases is a compensation to being subluxated is really going to result with very little positive change for a person who has fibromyalgia. These subluxations need to be addressed if the compensatory bad posture that comes along with them is going to be addressed, and bad posture must be addressed if we're going to try to minimize or manage anything that's going on with fibromyalgia. So, I hope that this information was useful. Please share it with anyone that you feel could benefit from having this information. Also, look out in Northeast Crossroads magazine. I've got an article on this very subject, fibromyalgia, that's in there right now. And also, for those who are interested and want more information and want some resources of where they can get more information for this, leave a link below or send me a private message or an email, and I will send you a free health report on fibromyalgia that's going to cover a little bit more detailed information than what I was able to provide in this short presentation. Again, I thank you for your attention. Please share this information, and I'll see you next month. Next month, I'm going to be talking about the importance of the cervical curve and how an abnormal curve, as a result of being subluxated, can have negative impacts on a person's health. Until then, thank you.